Gangaram Hospital in New Delhi has the largest privately run microbiology lab in India. Here, scientists are busy evaluating if medicines, antiviral and antibacterial, are still effective in treating the bacteria they were designed for. Recent studies show that India has the highest resistance to new drugs, and much of this is due to the rampant use of antibiotics for common ailments. In India, antibiotics can be purchased off the shelf from any pharmacy. Researchers say the problem is so acute that if we do not act now, it will take only 5 to 8 years for antibiotics to stop working altogether.
According to scientists, as early as 2020 is when we can reach an era which would be anti-antibiotic, which basically means that anyone who actually has normal issues like cough and cold or even viral fever, on them antibiotics will not move. On a more serious note, issues like liver transplant, kidney transplant and more serious ailments will take much longer to recover from.
Dr. Chand Wattal is one of the top doctors in India who has been working on the overuse of antibiotics. He says it's the over-the-counter sales without prescription that has led to this acute problem.
We talk of antimicrobial resistance, particularly antibacterial resistance, and we have nothing in pipeline. That's the worst part of it. The companies do not want to invest in this resource because it gets soon consumed and they even do not get their adequate returns as they expect. So why should they work on this kind of an activity, which is soon going to get depleted because of irrational usage? So if we irrationally use it right, left and center, we make these drugs redundant and these drugs stop working.
In India, one of the biggest areas affected is tuberculosis. Every year, India sees a massive 1.9 million new cases of tuberculosis. That's 20% of all the tuberculosis cases in the world. And from this number, as many as 70,000 have developed resistances to certain drugs. This means that other drugs have to be used in the treatment as patients are already resistant to the basic antibiotics. In fact, India has already begun seeing cases of extreme drug resistance in tuberculosis cases.
When they are used and misused, there are chances of getting resistant to these drugs. Now, when these drugs form a component of the regimen for tuberculosis, their effectivity goes away. So the cure will be delayed or the patient will not respond to these drugs.
But despite the serious implications of the overuse of antibiotics, India's national policy on antibiotics is still under construction. The policy, put on hold in October 2011, included guidelines to ban over-the-counter sales of third-generation antibiotics in pharmacies. India now stands on the brink of an anti-antibiotic era. Unless it acts now, it may soon find itself struggling to cure once ordinary ailments. Shweta Bajaj, CCTV, New Delhi.